Chapter 3. The Head, Face, and Neck. The frontalis. Attaching to the galea aponeurotica and the eyebrow skin, orbicularis oculi, and the root of the nose. Starting high in the forehead, spread your thumbs laterally to the temples. Move superiorly and repeat. To strip the muscle, glide your thumbs down towards the eyebrows. Move laterally and repeat. The occipitalis. Attaching to the galea aponeurotica and occipital bone. One way to strip this muscle is to use your fingertips to pull superiorly over the muscle. Make sure to check in with your client to see if you're pulling their hair. To use your thumb, find the occipital ridge, move superiorly, and use your thumb to glide laterally over the belly of the occipitalis. You can also use two thumbs to spread across the muscle. Move medially and repeat, working the entire muscle belly. The orbicularis oculi. With complex attachments to the structures of the inner orbit of the eye as well as the superior orbit. To apply compression, search for a common tender point near the lateral aspect of the eyebrow. Compress and hold for a release. To strip the muscle, glide your thumbs out the eyebrow. Repeat this again just superior to the eyebrow. Finally, glide laterally just inferior to the eyebrow. This is shown with one thumb. Zygomaticus major and minor. Attaching superiorly to the zygomatic bone and inferiorly to the orbicularis oris. To strip the muscle, use your thumb to glide from the zygomatic bone towards the edge of the mouth. Repeat this several times. The pressure is not deep, and it's also more of a stretching action. To compress this muscle, use a glove and squeeze the muscle between your finger and thumb. Explore the muscle at various locations, looking for sensitive tissue. Compress and wait for a release. The temporalis. Attaching superiorly to the temporal fossa and inferiorly to the coronoid process of the mandible. Use your fingertips to glide inferiorly towards the zygomatic arch. Move posteriorly and repeat. Always end in the same spot near the zygomatic arch as you continue your sweeps. To stroke across the fiber, use your fingertips to stroke from the temples posteriorly. End on the posterior part of the muscle belly. After your first pass, move inferiorly and repeat. Keep moving inferiorly with each pass until most of the muscle is covered. Another option is to spread your thumbs apart on the muscle belly. Move posteriorly and repeat. The masseter. Attaching superiorly to the zygomatic arch and maxilla and inferiorly to the mandible. To work this muscle, use your fingertips to glide from the zygomatic arch inferiorly towards the mandible. Move posteriorly and repeat. Move slowly, searching for tender areas. This technique can also be performed with your thumb. The lateral pterygoid attaches to the sphenoid bone and condyle of the mandible. The medial pterygoid attaches to the sphenoid bone superiorly and inferiorly to the mandible. Here's another view of the medial pterygoid with its attachment to the mandible and sphenoid. To work these muscles, feel around for the indentation just anterior to the temporal mandibular joint. Place your thumb in this indentation. Apply pressure anteriorly. After that direction has released, direct your pressure posteriorly. Now change the direction of your force and apply pressure inferiorly. Next, use your fingertips to find the angle of the mandible. Move anteriorly and curl your fingers under the mandible, applying pressure into the inner surface of the mandible. Find tender areas. Hold for a release. Levator veli palatini, tensor veli palatini, and the palatine aponeurosis. These two muscles attach superiorly to the temporal bone and sphenoid bone and inferiorly to the palatine aponeurosis. Place a gloved fingertip inside the mouth, glide posterior onto the soft palate, then medially towards the center. Another technique is to use a gloved hand and start the fingertip just behind the upper molar, then glide it posterior and inferior along the back wall. You can also glide laterally out towards the mandible. To work the coronoid process, use your fingertip to glide over the bone, which is lateral to the molars. You can also move your finger anteriorly to get in front of the coronoid process and apply pressure to the inside of the masseter. Platysma. Attaching superiorly to the mouth, facial muscles, and mandible, and inferiorly to the chest. To work this muscle, use the pads of your fingertips to glide from the chest upward. This muscle is very close to the surface, so this movement is more of a stretching than a deep compression. Move medially and begin again. Another option is to use your thumb and to glide down the muscle. The suprahyoid muscles are located above the hyoid, the infrahyoid muscles below. They all have a common attachment to the hyoid and above to the mandible and below to the sternum and ribs. To work the suprahyoid muscles, locate the hyoid bone with your finger, then use your thumb to glide anteriorly towards the chin. Make 2 more passes. Each time, move a bit laterally. To work the infrahyoid muscles, push the trachea aside with your thumb and use the fingers of your other hand to glide up from the sternum. On the next pass, move just laterally and use your thumbs to repeat. On the last pass, move laterally again and repeat. The digastric. Attaching from the center of the mandible to the hyoid bone to the mastoid process. Digastric means 2 bellies. To work the lateral belly, glide from the hyoid bone to the mastoid process, gliding under the mandible. Do this several times. To work the medial belly, use your thumb to glide from the edge of the hyoid bone anteriorly to the mandible. The sternocleidomastoid. Attaching superiorly to the mastoid process and inferiorly to the sternum and clavicle. To work the sternal head, start at the mastoid process and glide your thumb down the muscles to the sternum. The carotid artery and jugular vein lie under this muscle, so be sensitive to that. To work the clavicular head, perform the same technique, but this time move a bit laterally as you reach the lower half and end at the clavicle. You can see the 2 heads of the muscle fairly clearly here. To apply pincer compression, hold the head in your palm and turn it away. Squeeze the muscle between your fingers and thumb and hold for a release. Focus on squeezing the sternal head as you move down the muscle, waiting for a release at each spot. Next, squeeze the clavicular head between your thumb and finger. Move down towards the clavicle. This can be difficult to do since the clavicular head lies deeper. The scalenes. All three scalenes attach to the transverse processes of the cervical vertebrae and attach inferiorly to the first rib, or the second rib in the case of the scalene posterior. To strip the anterior scalene, start just posterior to the SCM. Feel for the transverse processes, then glide your thumb down the anterior scalene. For the scalene medius, start in the same position, but move just posterior with your thumb as you glide down. To strip the scalene posterior, start in the same position, but again, move more posterior as you glide down. You can also use your fingertips to perform this technique. To apply deep compression, use your fingertips to apply pressure to the distal ends of the scalene muscle. Stop if your client experiences pain, tingling, or numbness down their arm, which indicates you are pressing on the brachial plexus. You can also apply deep compression to the base of the scalenes with your client prone. Use your fingertips to find the muscles just behind the clavicle. Apply pressure and wait for a release. Stripping the scalenes can also be done in a prone position. Use your thumb to glide from the transverse processes down to the attachments on the ribs. You can also use your knuckles to work these three muscles. It is also possible to work the scalenes from a seated position. Use your thumbs to glide down the muscle while you are standing at the client's side. The trapezius. Attaching medially to the spinous processes, superior to the nuchal line, and laterally to the spine of the scapula. Use the palm of your hand to glide down next to the spine over the trapezius. Do this twice, then fan out towards the scapula. Finally, glide from the vertebrae straight out to the spine of the scapula. To perform petrissage, squeeze and pull the muscle between your fingers and thumb, alternating hands. To complete, shake the muscle several times. To perform pincer compression, grasp the muscle between your fingers and thumb and squeeze. You're looking for tender spots and waiting for the muscle to release. When it does, move laterally and repeat. Posterior neck muscles. All of these muscles attach superiorly to the occiput and inferiorly to the vertebrae. To strip the posterior neck muscles, use your thumb to glide down the posterior aspect of the neck. When you reach the base of the neck, glide up again. Stop at any tender spots and wait for a release. To release the upper attachment points, move to the side of the table and use your thumb to press deeply just under the occipital ridge. Wait for a release, then move laterally. Keep working out the neck, being patient and gentle. Another technique is to use your fingertips to glide from the upper back all the way up the neck. To apply cross-fiber stroking, bring your fingers across under the neck and pull back towards yourself, raking across the muscles. Start near the occipital ridge and each successive pass move inferiorly. You can also perform cross-fiber stroking with the client prone. Use your thumb to glide across the muscles. Start near the occiput. Glide from the vertebrae laterally. Move down and repeat.